Hello everybody, it's Walter, your favorite historian, educator, professor, and social studies extraordinaire, here today to discuss with you my proposal for national health care in the United States. American Universal Health Care, known as Americare. So having taken it upon myself to become an advocate for universal health care in the United States, this is a proposal for how such a program would be structured. It would be entitled Americare. The Americare National Health Insurance Program would be modeled after two existing programs. First, the long-established Medicaid program in the United States and the Canadian Universal Healthcare Program known as Canadian Medicare. For those who may be unaware, Medicaid is a federally established medical insurance program in the United States for very low-income individuals that is essentially administered by the states themselves, all right, the individual U.S. states. Outside of basic federal minimums, the U.S. states are responsible for determining the type, amount, duration, and scope of benefits offered to those enrolled in Medicaid, folks. As a program, it is funded jointly by both the U.S. government and the individual states. State spending on the program varies considerably from state to state, as does the federal contribution per state, as you would expect, all right? Similarly, as Canadian Medicare is a decentralized national healthcare program, it is governed by the provinces, all right? So, like American states with Medicaid, Canada's provinces and territories exercise large latitude in nuancing the program according to local needs, okay, as long as minimum guidelines are met. So funding comes to Canadian Medicare from the federal government as well as the provinces themselves, just like American Medicaid. That's why I grouped these two together. So having given you context and detail on how American Medicaid and Canadian Medicare are structured and function, I now move on to my design for how Americare would be structured in the United States. Americare would be a federally governed, voluntary national health insurance program which would be administered by the individual U.S. states in the same way the current Medicaid program is in the U.S. Unlike Medicaid, however, Americare would be open to all permanent residents of the individual states who choose to enroll. Residents would be free to enroll or unenroll in Americare at any point they wish. The program will be funded jointly by the federal government as well as the states based on the state's individual population and needs. With the subsidies from the federal government and minimum percentage from their own budgets, states will be required to fully cover all basic medical procedures and features for their residents, permanent and non-permanent, including, but perhaps not limited to, emergency room visits, essential prescriptions, hospital stays up to 120 days, doctor visits, outpatient services, essential surgeries, contraception services, health screenings, lab tests, maternity care, and home health care. States would be free to impose a small enrollment fee for Americare, as well as limited co-pays based on income for certain procedures to help offset these costs to the states themselves. All other expenses related to such procedures would be paid for by the state with the federal and state funding. Should an individual, for whatever reason, not be enrolled with Americare or a private insurance company and need emergency services, they would be allowed the full use of Americare covered services, but will be required to pay all associated costs out of pocket if they refuse to enroll in the program during or after their treatment. All right? Should they enroll, all these costs, minus the enrollment fee and copay, if applicable, would be covered by Americare themselves. So it would be no incentive to not join Americare. All right? This is fully covered health service. I mean, what is the drawback? Zero. So any medical services which fall outside of these areas would be up to the individual states to be determined on whether or not they would be covered with Americare funding. These services would likely include non-essential prescriptions as well as dental, vision, elective surgeries and procedures, cosmetic surgeries, etc. As such, the private health insurance market would still have an opportunity to exist and flourish in all likelihood, but with limitations. For example, in addition to providing coverage to non-Americare covered procedures as determined by the individual states, these insurance providers would also have to cover the same particulars that are covered by Americare that is required by the federal guidelines. All right. So these insurance companies would be required to cover both. Okay. They couldn't just leave you hanging for stuff that is covered by Americare. All right. Individuals would thus be allowed to have both private medical insurance as well as be enrolled in Americare if they wish. All right. That's totally up to you. Should a person receive a service that is covered by both Americare and their private insurance provider, it will be up to the individual to decide which entity would be billed for the service. Under no circumstance could any individual be denied enrollment or coverage by Americare or any private insurance company for any pre-existing conditions, as well as income status, age, gender identity, race, religion, creed, color, or national origin. Okay. Additionally, no hospitals or physicians would be permitted to refuse medical treatment or service to any individuals of the states under these same guidelines. Doctors and hospitals would thus remain private entities and would thus bill both the state governments as well as private insurance companies for their services. States would be responsible for setting reasonable limits on the fees to be charged by both physicians and hospitals for services performed. States would be given roughly a year to revamp their systems and amend necessary laws to be fully compliant with Americare's establishment. Once in full operation, all Americans would have full access to the health care they deserve without hamstrings or limitations. Universal health care in the United States would at last be realized. I'd love to know your thoughts on the proposal. Leave them in the comments below. Thank you so much for listening, and I can't wait to hear what you have to say about this. Like I said, this is the hill I plan to die on, and I will not rest until universal health care is established in the United States of America. Health care is a human right, folks. It's not a privilege. It's not something that should only be given to those who can afford it, okay, or those who are so financially in such dire straits that they must rely on government subsidies for health programs. Healthcare is something that everyone is entitled to. It's not a privilege. It is a right. And it is something that everyone, at some point in their lives, whether sooner or later, will need. All right? No one should go bankrupt, all right, because of a medical procedure. And no one should die because of inability to pay for a medical procedure. So again, I thank you so much for listening, and I've got to know what you think about this. So I conclude with the timeless words of my teaching role model, Mr. George Feeney. Believe in yourself, dream, try, and do good. And I'll talk to you at the next video. Professor out.